Did you know that there are more than 20 million people in Pakistan who suffer from mild to severe mental disorders? We always think that probably mental illness is something which is a product of the West. But although diseases may differ in their form and manifestations, we are not far behind. In Pakistan, every fourth family has a patient with mental illness. Of all the illnesses that a doctor sees, 80% are related to stress. And of the 10 major diseases in the world that cause maximum disability, 50% are related to mental health. I am Dr. Saad Malik. I have been in the practice of psychiatry for over 40 years, and I'm currently serving as Professor of Psychiatry at Shalimar Medical and Dental College. I am one of those meager psychiatrists in Pakistan who are serving more than 20 million people. You'll be surprised to know that whereas you have one psychiatrist for 25,000 people in the West, we have one psychiatrist for 500,000 people. And whereas 70% of our mentally ill people live in the rural areas, sadly, 70% of our psychiatrists are located in the major urban areas. So in Pakistan, even in 2021, 70 to 80% of our mentally ill patients have no access to modern psychiatric care. The only help, whatever help that is, they have is at the hands of the unqualified hakims, faith healers, maulvis, peers. And these people, whoever goes to them, whether you are suffering from epilepsy, psychosis, or depression, they are invariably diagnosed as suffering from the effects of magic, taweez, saya, jinn, or the evil spirits. And if the diagnostic process being wrong is not bad enough, these people are subjected to unimaginable tortures given in the form of treatment. In Pakistan, I am horrified to say that the most common method of treating mentally ill patients is not medication or counseling. It's beating them, it's chaining them to trees around shrines in the hope that they will get better. It's drawing blood from their head and forehead with the concept that this is dirty blood from the brain which has to be drained out. It's extremely shameful, but that's what it is. I often ask participants in my workshops and seminars, if they had a choice, what would they go for? A physical illness or a psychological or mental illness? I feel it's far worse to have a mental illness, because when you are mentally ill, you suffer the pain and anguish of that condition. But not only that, the people around you, your family, your friends, everybody suffers because of the effects of the mental disorder that you have. And if you happen to hold a responsible position, like a judge or a doctor or a bureaucrat or a politician, and if you are mentally unwell and you are not treated, you can imagine the consequences of this situation. In the videos that we will be presenting before you in the next few weeks, I hope to do three things. Firstly, we will be talking about common mental disorders, what causes them, what are their manifestations, how are they treated, and how can they be prevented. Secondly, I am a great believer in what is called positive mental health. Positive mental health means that to be mentally healthy does not simply mean that you don't have depression or anxiety or some other problem. It's a state of mind in which you have a goal-directed life, you have happiness, joy, you have peace of mind, you have control over your negative emotions, and you have stable relationships. And in this context, we'll be talking a lot about different strategies which can ultimately achieve this state of mind. For example, we'll talk about stress management, communication skills, conflict resolution, how to manage relationships, marriages, old age problems. It's a long list. And thirdly, in these series of videos, I'll be interviewing celebrities, eminent personalities from different walks of life to see how did they manage their life stresses, what were the ups and downs, and what you and I can learn from their lives. Our own lives are too short to teach us all the lessons of life. But by meeting such people, we hope to learn from their successes and their failures. People generally avoid going to a psychiatrist because they think only mad people go there. But I think a psychiatrist is like a plastic surgeon. We treat emotional scars, and emotional scars are different from physical scars. Physical scars are visible and they can be treated, and their effect is not particularly long-lasting. But psychological scars are dangerous because you don't see them. Number two, even the person who has them is unaware of them. And thirdly, they have very long-lasting consequences. They can affect your relationships throughout life, and you wouldn't even know that. Please understand, mental health is no longer a luxury. It's an essential part, a necessity of our lives. And it encompasses a wide area of our lives: growing up, schooling, education, relationships, emotions, job stress, marital stress, old age issues, divorce issues, job stress. It covers a wide domain from raising children to running a country. There's no health without mental health.